Hey guys, Dr. Shawhead here, and in this video, we're going to explore the science behind shade selection. Let's get started by first describing the Munsell System, which is just a cool way to categorize and measure color. It breaks down color into three primary dimensions. First we have value, then we have hue, and finally we have chroma. Now, one important point to remember is that these three dimensions, hue, value, and chroma, are interrelated, meaning they work together to determine the overall appearance of a tooth or restoration. It's also important to note that the Munsell system doesn't include translucency, although translucency is an important consideration for aesthetics. Alright, let's take a deeper look at value, which is the most critical dimension in shade selection. Value refers to the lightness or darkness of a color. A high value means the tooth looks lighter or whiter, while a low value means the tooth appears darker or duller. In clinical practice, you'll find that value mismatches are often more noticeable than hue or chroma mismatches. For instance, a crown that's lighter or darker than the surrounding teeth will immediately stand out, even if the hue or chroma are correctly matched. That's why value is considered the most critical aspect of shade matching. Many dentists will focus on getting the value correct first, since it's the hardest to disguise. One important thing to note is that value can't be increased after the fabrication of a restoration. It can only be decreased, which is all the more reason to spend extra time on the front end to make sure you get it right. Alright, now let's talk about hue, which refers to the basic color family of the tooth or restoration. This one's the easiest to understand in my opinion because every color we know of is technically a different hue. We have red hue, blue hue, green hue, etc. Now, in the concept of dentistry, the hues we're typically concerned with are variations of yellow, brown, and gray, since these are the natural colors of teeth. Now, hue can be adjusted to some extent with staining. It can't be changed entirely, but small changes in hue can be made using stains or glazes. So it's important to get as close to the correct hue as possible during the initial shade selection process to ensure that the restoration seamlessly blends with the remaining dentition. Okay, time for chroma, which refers to the intensity or saturation of a particular hue. So in this case, blue will be the hue, and all the different types of blue you see here are just different intensities of blue. So a tooth with a high chroma will have a more intense, vibrant color, while a tooth with low chroma will appear pale or more muted. Now, just like hue, chroma can also be adjusted after a crown or restoration has been fabricated. And this gives us some flexibility for fine-tuning the restoration, but again, that takes time, and time is money, so spend the time on the front end to get it right. Switching gears now, we're going to quickly talk about metamerism, which refers to the phenomenon where colors appear different under various lighting conditions. To understand this, let's consider a common scenario. A patient approves the shade of their crown while sitting in a dental chair where the lighting is typically artificial and bright. However, when the patient gets home or goes outside and looks at the crown under natural light, they may notice that the color of the crown appears different. The crown may look lighter, darker, or even have a different hue when exposed to different types of light. This is metamerism in action. So, what can we do to minimize metamerism? Well, the most effective way is to use different light sources during shade selection. And if that's not possible in your dental operatory, get creative. Move the patient around, go somewhere where there is sunlight, go outside. As long as you approve a shade in a couple different lighting environments, you should be good. Okay guys, so far we've talked about hue, chroma, and value as key elements of shade selection, but there are actually several other factors that can influence the final appearance of a restoration. The first factor we need to consider is the metal substructure in PFM crowns, and I talked about this a bit in the material selection video, but when you have a PFM crown, the metal substructure can sometimes interfere with the appearance of the final restoration. So if the metal layer beneath the porcelain is too thick, it can make the crown look opaque, leading to a dull gray appearance. But what if the problem isn't with the underlying metal, but instead with the overlying porcelain? Well, turns out porcelain thickness is another factor that can affect our shade. Porcelain is only nice and shiny if we have sufficient amounts of it. When we don't, our crowns can again appear opaque or dull. Alright, enough of PFMs. Let's switch our crown to an all-ceramic crown so that we can talk about our third factor, which is stump shade. The stump shade refers to the color of the abutment tooth after it's been prepared for the crown. If the stump shade is dark, it can show through the crown. Now, as you can imagine, this is particularly important when using glass ceramic crowns or other translucent materials, because stump shade isn't really an issue when we have a PFM crown since the metal will completely mask whatever the color the abutment may be. So when you're planning on fabricating a glass ceramic restoration, you'll want to communicate the stump shade to your lab, and you can do so by either making photographs of the prepared tooth or by simply using a stump shade guide. Alright, we have one last factor to discuss, and it's actually just the timing of the shade match. So when's the best time to shade match a tooth? Well, generally, you'll want to do this right at the beginning of the appointment, before you've even touched your handpiece, because that's when the tooth is hydrated, and so that's when you'll get the most accurate and natural measurement. But the reason I say generally is because sometimes patients don't want you to make a crown that matches their old shade. They want something brighter and whiter. For these patients, whitening is typically in the treatment plan, and so it's important to wait 1 week after the whitening procedure to take the final shade, just to give some time for the final shade of the crown to settle in. And now I gotta dedicate a minute to one of the most important tools we use in shade selection, the shade guide. Shade guides are universal tools that help us systematically select the appropriate color for restorations. A typical shade guide is organized into a series of hues that are arranged from light to dark. For example, the A hues fall within the reddish-brown color family, B hues are reddish-yellow, which is common for lighter, more vibrant tooth colors, C hues are gray, and D shades are reddish-gray. Within each of these hue families, the chromas are designated by the numbers. The lower the number, the less saturated the color, and the higher the number, the more saturated the color. So for instance, A1 is a pale reddish-brown, while A3 is a more intense version of the same hue. It's also important to note that these shade guides are not selective for value. And with that, we're done, guys. Let's reinforce everything we just learned with some practice problems. First question reads, a patient came in 1 week after crown placement complaining that the crown was too white. Each of the following can explain the error when prescribing the shade except one. Which one is the exception? So pause the video if you need some time to get your answer, which is B. Shade guide did not match the guide used by the laboratory. Best way to tackle this one, guys, is through process of elimination. A is incorrect because eye fatigue does limit our ability to accurately judge colors. C is incorrect because we all know that shade matching has to be done at the start of the appointment before the preparation, not at the end. And D is incorrect because of the concept of metamerism. The only option that doesn't make sense is B because remember, guys, shade guides are universal tools. The Vita shade guide at the lab is going to be the same exact one in the dental office. So that's not a valid reason here. Okay, moving on to the next question. Each of the following can be accomplished with staining of a crown except one. Which is the exception? Again, pause the video if you need, but the answer is C, increased value. Remember, guys, out of value, hue, and chroma, value is the only one that can't be increased after the restoration is fabricated. It can be decreased or the restoration can be made darker, but not the other way around. Okay, I have one more for you guys. During delivery appointment, the PFM crown appears much whiter compared to the adjacent natural teeth. What will be the most appropriate action for achieving an aesthetic result? Again, pause the video if you need, but the answer is B. Send PFM crown back to laboratory for shade modification. This question is very similar to the previous in that it's not only assessing our knowledge of the fact that a value can be decreased along with changes in hue and chroma, but also the fact that we have to do something here. We can't just be okay with a crown that sticks out compared to the adjacent teeth. And with that, we are done. As always, here's a summary of some of the high yield points we went over in this video. Thanks for watching and see you next time.